Hello and good morning. I'm Ferdinand Salazar and I am from the Medical Entomology Department of the Research Institute for Tropical Medicine. I've been with RITM for almost 30 years. I started as a contractual employee under the then known as the New Tropical Medicine Foundation. And I started working as a medical entomologist for RITM. I heard that there was this vacant for the said position and I applied. And that's the start of my employment history. When we get to the community, people get very interested with medical entomology. To some people, it sounds funny, but it catches attention. So the activities that we do, for example, we do human landing collections, we do carabao trap collections, which fascinates people and ask a lot of questions. In a way, we are able to share information with them, and hopefully it helped in some ways to affect their behavior. So I'm lucky to be part of the pioneering group of the malaria study group of RITM, which embarked on this particular project called Understanding the Dynamics of Malaria Transmission in a Low-Endemic Area in Morong Bataan. We tried to understand actually the different factors concerning malaria, how it is transmitted, the behavior of the people, the behavior of the vectors, the factors which are causing increase in transmission, and then try to find some solutions for the control of the disease itself. So as part of the project, we implemented early case detection and treatment. We started a participation of the community volunteers, and then we do some vector control intervention like stream clearing. And actually this project became very successful. And it was replicated in another municipality that was in the Llanos, Quezon. From municipal project, it became a province-wide project already, and we moved to Agusan del Sur, which has become a province-wide malaria control program. And I think it served as the model for the Department of Health for the control of malaria in the Philippines. And I guess together with the learnings of the Malaria Control Service, this formed basically the most of the intervention that has been implemented by Malaria Control and Elimination Program. And then we started monitoring insecticide resistance. We established the sentinel sites, and we have done it for almost 20 years. And with the help of CEO, we were able to come up with the recommended policy for the change in the use of insecticide. I think that the biggest struggle that we have was during the separation of medical entomology from the Department of Parasitology, because from that point we need to look for our own funds and researches. As you know, our ITM that time do not provide research funds, so we really have to write proposals and compete for grants. And we started like there were only 3 of us, and then there were 3 people that were transferred to our ITM from the Department of Health. So basically that formed the basic personnel of the Department of Medical Entomology. We collaborated with the program, and through the program they gave us funds to build a facility, laboratory, and then we were able to have our own mini molecular biology laboratory for the department itself. And we were able to conduct regular or yearly yearly meetings for all the regional entomologists of the country, because we are the ones also providing updates for them. We train them for basic entomology, for the conduct of basic entomological studies in looking at the distribution and abundance of vectors in the area, and also in evaluating the control intervention if they are effective. Basically it's for the department. I want the department to generate more expertise, particularly in the field of medical entomology. As you know, entomology is supposed to be a big field, and only a few people are interested in working with it. The department now has 29 staff with it, and we are trying to train our staff to be expert of several fields in mosquito-borne diseases. So there should be a particular person who will be doing systematics. Not much people are doing systematics like nowadays. for mosquitoes, and then doing insecticide resistance work, doing molecular biology work for mosquito, detection of pathogens that are carried by mosquito, or looking at the viruses which can be found in the mosquitoes itself. So those are some basic expertise that we have, and we need some expertise probably with ticks because it's been neglected for several years. We don't have any data whether there are tick-borne diseases currently occurring in the Philippines. So that's a very limiting factor. For those who want to pursue medical entomology, I think you just have to know that it is really the field that you're interested in, because for you to develop your expertise, it should take you a very long, quite a long time. I used to be looking at the information and trying to be up to date with those information, but my realization is that we should be taking our independent path and look for some roads which are not yet tracked, or if you will be able to create your own path. I think it's more advisable to do. In a sense, you will be providing unique and probably really new approach to the control of mosquitoes, not only in the Philippines but the world. But I think my last statement would be, which should be the most important one, is submit to the Lord, seek for His guidance, and make sure that everything you do is for His glory.